title that you need.
We're easy compared to that.
Yeah, I can, let's maybe to the bathroom, I think we can.
Great. Move on with the citizens' concerns regarding San Juan Basin Public Health. Citizens are out. Morning.
Good morning.
Good morning.
Morning, Commissioners. Thank you so much for agreeing to meet with us. To hear both our concerns and our ideas for solutions. Today we want to share with you a vision for healthcare in Archuleta County. First, let me introduce our small little panel here. 3 of us moved here from other Colorado towns, and 1 of us from all over, but most recently Arizona. I think all of us would agree that we all got here to this town through divine intervention. My name is Shailene Zarati. I'm a mother of 4 beautiful, healthy children. My husband and I moved here from Evergreen, Colorado almost 3 years ago. I've been practicing massage and body work for 20 years, and currently I'm getting certified in holistic nutrition. We'll be integrating that into the ways I help people in their health and wellness. You all have met Mary Beth Snyder. She served as the Secretary of the Health District Investigative Committee at the end of last year. She's a retired small business owner, a 14-year geriatric and hospice nurse, and a board member for an important local nonprofit. Catherine Ryden-Howard is a retired battalion chief from Aurora Fire Department and has lived here since 2010. She volunteered with Pagosa Fire for 5 years and was a volunteered for hospice for 3. Catherine was a command officer, the chief in charge of Aurora's Fire EMS division, and is a nationally recognized instructor. Dwight Billhauer devoted 30 years serving as a Christian adult education and music director, 15 years of which were as a pastor. He has a 25-year career in financial management and investment. He is a published author, having contributed to many Christian works. And I'm going to turn it over to Dwight.
Thanks, Shailene. You can go to the next slide, please. We're here today because we know we have a common concern and care, and that's for the health care of everyone in our community. That's one thing we all share. And so we're just here to talk to you about that today. Primarily, the purpose and goal is this, to encourage you to do something that I know you've already talked about quite a bit, to complete the investigative committee's work by forming perhaps a smaller task force to look at areas where they hadn't completed their work, to do a cost analysis for forming our own county health department. So the main objective in us being here today is to encourage you to establish a local health department to more effectively preserve and protect the public's health by improving things in the following 4 areas. And the presenters here primarily will be speaking on these 4 areas. First of all, education in health, preparedness in health, transparency and communication, and then also management of a new healthcare department. We'll also, after that, be sharing with you, Mary Beth has some information on some demographic information that you might find useful. And then we'll just close it up and open it up to your questions and comments. I think the next speaker is Catherine.
Good morning.
Next slide, please.
Good morning. Thank you so much. I'll tell you, today's been a real eye-opener of the depth of issues just today. Holy cow. But what I really can tell is how each one of you cares so much about our community. And that really, really shows through, so thank you. So I'm going to talk about illness prevention, the first 2 bullet points, basically healthy lifestyles, therapeutics, treatment, in terms of education. With the recent pandemic, which has affected every life, not only in our county, but across the world as we know, the media in San Juan Basin's sole focus was on the vaccine, not on how to prevent and treat the virus. There are many time-tested, science-based, and peer-reviewed studies on simple, effective, and safe tools to prevent and treat COVID, as well as other respiratory viruses, such as a foundation is really vitamin C, vitamin D3, and zinc. And everything I've studied and everything that's out there, that seems to be really the basic tools. There's also things with nebulizing and many other supplements which have been proven to reduce symptoms and prevent death, instead of just a vaccine-only approach. And I want you to know I'm not anti-vaccines. When I was the EMS chief for Aurora, I was in charge of our Shots for Tots program. So I definitely understand the importance of those kinds of programs. So complementary modalities, such as educating our public about how to prevent the disease in the first place, is critical. And many in our community have opted to use them, and very successfully, I might add. I just want to briefly mention the criticality of vitamin D3. I'd love to give you an infomercial on D3, how important it is to our health, especially when 6 months out of the year, no one in our region gets the right amount of sunshine, no matter, you could stay outside all day. For 6 months of the year above the latitude line of Atlanta, Georgia, none of us are getting the right kind of sunshine that we'll be able to synthesize within our bodies. And D3 is just critical, very well studied and well documented, and especially its proven effects on COVID. Numerous studies have shown that adequate levels of vitamin D3 significantly reduces ICU admission and death from COVID. Over the last 2 years, there's been multiple studies stating that if people had adequate levels of the D3, they could have prevented between 60 and 90% of all COVID deaths. Now, why aren't we being informed of that? This isn't just an opinion. These are real studies by doctors that are, that are really caring about their communities. The benefits of higher levels of D3 are numerous and vital. Even in cancer, they're saying, for example, breast cancer, if women, which affects 1 out of 7 or 8 women these days, where's the education that adequate levels of D3 can protect them anywhere from, studies show, between 16 and 60%. That's the kind of education that we all believe should be out into our community. And let alone the other things that are simple, safe, and inexpensive, like the vitamin C and zinc. The supplements that are effective to boost our natural immunity, and we're not hearing about those from our health professionals currently. There is overwhelming evidence and systematic review showing that D3 alone is a clear winner in assisting COVID patients. And we know that our high-risk patients, especially the elderly and people of color, because of the skin pigmentation issues, are also our community that has the lowest levels of this. Another safe and well-established, simple way to prevent viruses, especially respiratory viruses, is gargling and cleaning the nasal cavity. All scientists know that respiratory viruses, and specifically the Delta variant, replicates rapidly in our nose and mouth for 3 to 5 days before it affects the rest of our body. There are very simple ways that we could educate people on just the health strategy of an oral rinse and gargle and a nasal rinse, doing it 1 or 2 times a day, could help us all reduce our infections, even the common cold. It seems reasonable and common sense to many in our community that any health department that wants to serve as a frontline defense against health emergencies would consider all therapeutics and all educational means and natural effective remedies, rather than relying on big pharma and vaccines alone, if they were truly focused on serving the population. It appears that San Juan Basin spent $600,000 on advertising the vaccine. Now, I don't know about you, but I saw advertising absolutely every possible format that you and I access every day. We would ask if that money could have been better spent on identifying those simple and safe strategies to keep, and also that are highly effective that in combating the disease in the first place. When it comes to program and materials specific to our county needs, is our community different than La Plata County? In demographics, in politics, in location, and things of that nature? Is San Juan Basin specifically addressing our own needs? Later, Mary Beth will share some pertinent stats with you. And I'd ask if we who live and are invested in Archuleta County could do better with education and outreach, and customizing programs for our community. And I'm going to give you an example of 3 programs that are not currently being addressed. 1, fall and injury prevention for our elderly. These are simple, well-established programs. We could be, our own health department could be coordinating them throughout the county to really keep this community as safe as possible, because we do have an aging population here. 2, programs that address special needs for children and adults. We do have certain programs here, but we don't have a coordinating effort being done. A friend of ours that has an autistic child is literally at her wit's end trying to find appropriate assistance, and it's heartbreaking. 3 is realistic resources for those who live in the remote regions of the county. Our geographics have big implications on our community, as you all are very well aware of. One is that we are basically isolated in cases of natural and man-made disasters. Whether it be flooding, avalanches, wildfires, mudslides was mentioned earlier, and Lord knows we could all use the rain. We'd all like that rain to come. But can we increase our ability to assist those living remotely to survive when being cut off from our normal services? And we think we can present programs that would be vital to that population. And let me give you an example that relates here. If we have a major fire in town, our nearest mutual aid is Upper Pine, which is Bayfield. They are 45 minutes away if they can immediately jump in that engine and come here. When they do, they bring one engine with 3 or 4 people. Sometimes a command officer will accompany them. That is only if they are not on another call. That is only if whatever is affecting us isn't affecting them. But that is our nearest mutual aid for just fires in this county, okay? And so how does that work when we're having our own natural or man-made disasters such as a hazmat spill or anything? What does that response look like to get us here? And you guys know this much better than even I do. One of our goals is that we should be more self-reliant and self-governing on these issues. We believe that custom and Archuleta County specific programs that are based on strengthening our community partnerships with the hospital, with EMS, with the Emergency Operations Center, with all the healthcare providers, assisted living communities, the school district, the Southern Ute tribe, obviously, child care, to help us have that umbrella to help us specifically meet their health needs. And who better than our own talented community to take care of our own and take responsibility of our urgent issues. The data-driven risk-benefit analysis for all prescribed treatments. I want to just briefly mention, well, actually, I'll get into that later, but we could have a health board that looks at all genuine science and peer-reviewed studies and keeps updated on the risk, not just accept one line of thinking. In regards to the pandemic, studies and outcomes have shown that communities and countries that protected their most vulnerable populations, such as the elderly, those with the comorbidities and immunocompromised, have fared the best. On the fire ground, as an incident commander, I performed risk-benefit analysis 100% of the time. That was my job. And every single emergency was different, every single fire was different. By having our own health board, again, focused on Archuleta County, we can continually perform that risk-benefit analysis on our community, on our programs, and make adjustments necessary in real time, much quicker than we could now, to protect our own county and not be the smaller piece of the pie like we are now. Informed consent. This is especially in regards to the COVID vaccine. Even the National Institute of Health, the National Library of Medicine, produced a report, in essence saying this: patient comprehension is a critical part of meeting medical ethics standards. And that in the COVID vaccine trials, that adequate patient comprehension of risk essentially did not occur. In other words, informed consent was not handled well then, nor has it been handled well while administering the vaccine. With this new and often controversial treatment, how many of us were fully made aware of the potential adverse outcomes? Informed consent is an important part of ensuring we are protecting our constitutional rights. Compliance training. This is in references to the businesses and entities that must be evaluated and inspected by the health department to ensure safety and compliance with state and national standards. These entities are food, restaurants, nursing homes, healthcare providers, in-home healthcare, assisted living, everything. But so could a locally focused health department meet the needs of our health and business partners better? We can have more closer connections to them and be able to train, to help train them to ensure compliance and to be there to assist them when needs arise on an immediate basis. Food establishments such as restaurants, which we know are a very vital part of our economy, are required certain health inspections, not only to get a license, but to keep it through regular interval of inspections anywhere from 2 years to 6 months to 2 years. Our group has been made aware by local restaurant owners that some are highly dissatisfied with current practices. To be fair, others are satisfied. So we're not here to bash San Juan Basin. We're here to say, can we do this better? But we wanted to share with you these concerns because we had heard complaints such as unprofessional conduct and not being knowledgeable in industry standards, as well as being unwilling to educate and work with business owners on how to be compliant in a timely manner. One concerned restaurant owner was threatened by a health inspector to shut down the business. Yet, this owner had not seen an inspector in over 2 years. Can we do better for our community by assisting all of these entities from healthcare to food service comply with our very important, state and national standards, because our local health department would care enough about them to educate and train them and work with them and build true positive relationships. And from what we're being told, many of these entities are fearful to complain because they fear retaliation. And that's what we've heard. By employing dedicated locals who have a stake in ensuring our safe eating, our safe living conditions, and promoting healthy living, we can perform specific outreach and services to not only our businesses, but our community members. So the question is today, can we do better? By creating our own health department, can we build more trusting and lasting relationships and partnerships with all of our community leaders that I mentioned to better serve this county? We believe it is imperative to explore this option with all the positives it could bring, be realistic with any of the negatives, and have one common goal, and that is invest in and make our county as healthy and safe as possible. Thank you very much.
Okay, next screen here.
We're gonna talk a little bit about improved preparedness. I think we could do a better job of that as well. And that would include additional healthcare and in-home care plans when the medical system is overburdened. We've experienced this. Provide contingent additional healthcare services in emergency situations. Customized, I guess you could say. Provide additional medical equipment, supplies, and protection to armed healthcare providers for homebound and outpatient care, and cooperate with the school district to avoid school closures by doing risk analysis. So preparedness really is defined to make ready beforehand, to procure ahead of time, to work out the details of and plan in advance. I mean, she talked a little bit about the what ifs. What if there was a wildfire and this whole valley was filled with smoke, and we have these people living in remote places who already have breathing problems? Who's gonna go find them and make sure they're okay? I mean, what if there was a long-lasting power outage? We've got that same problem with people that use electricity for medical reasons. What if there was an epidemic? I mean, imagine that. I think we could do a better job of preparing for what's needed in real time rather than waiting. At one point in time, I cried out for help with people who were sick at home and got no attention from San Juan Basin Health. So I'm thinking that planning and procurement and preparedness is how we would also protect the health of this community. We could identify the vulnerable in advance, know where they are, have equipment, medications, source options, volunteer lists, and be ready to go and save lives. Not everybody's gonna show up to the medical center, and it doesn't have room for everybody anyway, so I think we could do a better job. More than just conceptual plans, an actual boot on the ground preparation. Because who do we call when this all falls apart? It's not San Juan Basin, I tried that already. Okay, I think that's an area, so. And
Shaylene's got the next slide.
Is she okay? Shaylene.
All right, well, I'm gonna be talking about transparency and communication. I believe the root of our societal problem stems from our inability to have civil discourse, public debate, and free exchange of ideas. Without it, though, we aren't able to arrive at truth or science or solutions. It's been painfully challenging to have civil conversations about important issues with each other, with how politicized and polarized things have gotten. And depending on where you get your news and your facts, you truly are living in different worlds. I mean, truly. This is especially true when it comes to our relationship with our public health department and the people that they serve. I would especially say between San Juan Basin and Archuleta County. Just last week, Leanne Johns reported to you all a survey that indicated that people in the medical field feel threatened by people who speak out against their narrative and their medical recommendations, and therefore they need better training to respond to political conflict. She feels misinformation is to blame. I'm wondering if she believes people aren't smart enough to discern and decide what is best for themselves, to choose with their own free will what goes into their body. Compliance would be so much easier if they could just dictate what they want us to do. Never mind we actually look at the ever-evolving science. What's interesting to me, though, is the lack of transparency and communication coming from San Juan Basin Public Health. Not to mention the misinformation they themselves have put out. They have done a poor job answering our questions or addressing our concerns publicly. I would love to see a survey that asks the public if they feel safe or if they trust the medical establishments now. I bet many citizens feel just as bullied and ostracized as the healthcare workers do. We've all been subject to coercion and dishonesty. But the real problem is when people refuse to go to the doctor or hospital when they need to because they don't trust it. Truth plus transparency equals trust. Transparency and communication is critical. San Juan Basin Health thinks we should just blindly trust them because they declare themselves arbiters of truth and champions of science. The conflict of interest between governmental health agencies and big pharma, along with mainstream media that makes up our health apparatus, has done a great deal these past many years, which has absolutely been brought to the light by this pandemic. It has earned the distrust of anyone who is actually paying attention. If Archuleta County could create our own health department, we would have the ability to track our own services, to produce our own records, and to use that data to inform ourselves about what our specific needs are. We wouldn't have to rely on the district department to send the information to us like we do now. In fact, the Health District Investigative Committee asked the health department during their research, and San Juan Basin was only able to provide 10 of the 35 questions they asked. That's less than 29% of the questions were answered. We would know exactly what our money is going into, what services, and exactly how many people were served, and exactly how each policy and procedure were being performed. Not only that, but we could track disease trends and breakthrough infection more closely, and lawfully report on adverse events, which, by the way, are huge indicators for whether the novel vaccines are truly safe and effective. By having our own health department, our board and medical staff they oversee would be residents of the town they serve. They would have more direct contact with members of our own community and have a more vested interest in the quality of their services. They would be more apt to address our local issues. No longer outsourcing all of our services to outsiders, we could produce a more focused and customized plan to fit our demographics and community needs. We could provide stable jobs and be better partners in health if we had our own department. And we could rebuild trust by having better communication and more transparency.
Thanks, Julie. Next slide, please. I'm going to share with you some thoughts and information on improved healthcare management. First bullet point there, selection of health board members by the elected county commissioners. And I put up a reference there to Colorado Revised Statutes 25 1-508 in the subparagraphs. I'm aware of the fact that the investigative committee was made aware of the fact as well, that in November of 2020, a request was made by the commissioners of both La Plata County and here in Archuleta County to amend the procedures by which health board members were selected. And the request was that the Archuleta County and La Plata County commissioners would be the ones who would select those individuals. I think Commissioner Brown, you weren't yet serving on the Board of Commissioners at that time, but the other two were, I believe. That's when we were kind of moving into the area ourselves. That was rejected by the attorney for La Plata County, I believe, was the one, and along with other resolutions that were submitted. In fact, all that and all of the other resolutions were rejected, saying they were contrary to state statutes, which was accurate as I reviewed it myself.
Just to be clear,
Yeah.
the San Juan Basin Public's health attorney, not like.
Oh, it was. It wasn't a, thank you. Okay, I stand corrected on that.
And it was number 227, I think, the resolution.
I don't get that.
But currently, that is who appoints the board members, is Archuleta County Commissioner and Plata County Commissioner.
That was a resolution that was rejected.
No,
In a health
Just to be
what they
clear,
rejected
this-
was alternates.
when there's a regional health board,
The health
there's actually
district.
an appointment committee that
Right.
appoints the members to the Board of Health. That appointment committee is made up of the Archuleta County Commissioner and the La Plata County Commissioner, and that's set in state law.
Yes,
So,
Just those
But-
two people.
just those two.
Those two commissioners, not all the commissioners.
Right, it's just the two that serve on the board.
And that's the point that I want to make.
I just wanted to clarify what the
Yeah,
actual structure is.
yeah, because the important point, I think, with all of this, if the resolution requested that all the commissioners from both counties select the members of the health district board, that is not allowed by state statute. Right. What is allowed by state statute is when we have our own health department, those selections to the county health board are made by you three commissioners. And so if that is something that was desired to be done back in November of 2020, and perhaps by other commissioners who served before you gentlemen did, that is something that we certainly would be able to accomplish. And I think we want elected officials to make decisions on board membership. And that's far preferable to just an internal committee it only is composed of a couple of commissioners from both counties. It's far preferable that we have you as our elected representatives select those who are serving on the county board of health. The second bullet point, select board members invested in our unique county needs who will also protect our constitutional rights. We want health members on the board who know our county's needs. And I just don't see how with a lot of that was mentioned by the other speakers already. San Juan Basin Health just is not that in tune to what our county needs are. And we've seen through this presentation from the others here how they have failed in that regard. So local people would be most familiar with our local needs. We want individuals also who have a high and healthy respect for our Constitution, American history, and follow those rights and privileges that are spelled out to us in our Constitution that are God-given rights. We want to develop and exercise policies that are respectful of those rights and freedoms, because in the age in which we live now, we see nationwide, in many states and many different counties, how these rights and privileges that are guaranteed us through the Constitution are being challenged. And the desire is to replace it with something else. And so we want board members who have a devoted, healthy interest in keeping the rights and privileges spelled out in the Constitution active and faithful to those rights for all the citizens of our county. It would also bring health board jobs into our community. As of the investigative report that you received, they discovered that at that time that San Juan Basin Health had 91 employees in their health department. Do you know how many individuals in that health department were residents of Archuleta County? Do any of you know?
Less than 5 or less.
At the time the investigative committee received the information, 2.
One was part-time.
Okay, then that's even new information for me. Yeah.
2.5.
So I think it's important that we ask ourselves, as citizens of the county, residents of the county, as commissioners serving the county's needs, how in the world can the needs of our county be recognized and met properly when only 2 employees, or under 5, whatever it may be now, are serving in that capacity in the district health department? When we have our own health department and board at the county level, we can employ individuals from our county. 100% of them will be aware of our county needs and serving the residents according to those needs, being guided by our county commissioners. That is tremendously powerful and necessary for helping the people in this county. If we keep things the way they are, not only as representative levels on the board with, Mr. Schaaf, you're serving as the only member on the board, along with one other individual from Archuleta County, and then the limited number of employees.
There's 2 people from our county.
Yeah, that's what I mean, you and one other.
No, myself and 2 others.
On 2 others, okay. That, and also with the number of employees in the district, that limited number of individuals will always be in existence. We will never be able to accurately address the needs or express ourselves freely in this district health board. We will never be able to establish local control and serving locally the needs of the residents here. There are so many advantages to having our own health board, and that's why so many other counties, even in the state, are looking at removing themselves from district arrangements and setting up their own county boards. We would be well served when we do the same thing ourselves here in Archuleta County. Bullet point number 3, establish optional programs and policies offered to the public. If you go on the website for the San Juan Basin Health Department, they have, if you go up to the right column and click on the About Us section, when you look at how they describe what the purpose of the district health department and the board is, they give a pretty accurate summary of taking the Colorado Revised Statutes and boiling it down to just a couple sentences as to what their responsibilities are. And it reads as follows. The health board's involved in administering and enforcing public health laws, rules, orders, and standards of the state, as well as orders and rules set by the Board of Health itself. So that's pretty accurate in summation of what the Colorado Revised Statutes require of them as a district department. And the same requirements would be for us as a county health department with our own board of health. But that requires that the local departments of health is also concerned about the rights and protections of its residents under the law. It means that they also be careful not to impose excessive restrictions that violate constitutional freedoms and rights, and that they're free to choose optional programs. Now, you all are probably aware of the problems and the objections that were raised by people in the community and parents in the community to the Junior Heroes program when it was presented and kind of, I have to put it this way, it was snuck into the high school without any knowledge of the principal of the high school. There was no knowledge that was given to the superintendent at the time, and it was done without proper information being provided to the parents to offer their consent. That was an optional program that was presented to the San Juan Basin Health Department, and they simply ignored getting permission to present that to the students before it started happening. As a local health board, we'd be able to address those optional programs at our own level, within their own county. There are also greater restrictions that were continued upon our county and also LaPlata County when the governor had basically lifted a lot of his restrictions statewide and left those decisions up to the local health departments. We'd be able to better address that according to the needs during any pandemic situation or other situation, emergency situation, especially what the situation is our own county. But in this case, we had to rely upon even continued excessive requirements and mandates that were required by the San Juan Basin Health Department, our district. Bullet point 4, determine where to allocate health resources and services. The investigative committee received a chart from San Juan Basin Health that indicated how their overall resources are spent. And I just want to briefly show it to you here. You notice this big, in this pie graph, this large section here.
Personnel?
Yeah, that says salaries and benefits. Do you know what the percentage is?
8%.
Yeah, that's right. You're aware of that.
Of 8.6 million, sorry.
Yeah, that's right. 80% of those services go to administration. If a charitable organization were coming to you and asking for your donations to that organization, one of the questions you'd probably ask, and rightly so, I think we've probably all done it at one time or another, how much of the money that I give to you will be going toward administration? And if you heard that that charitable organization was going to be spending 80% on administrative costs, I doubt that you'd be very inclined to give to that charity. Having our own local health board, we can control those costs. So much of it right now is completely out of control. In fact, I believe what we have in San Juan Basin Health is a government bureaucracy that's run amok, that is really out of control. We see no separation of costs and services for Archuleta County, in spite of the fact that it's been requested over and over and over. A clear, precise, defined presentation of how those expenditures are meeting the needs of Archuleta County residents and how they're being separated out. We've been lost in no explanation for years, and this has gone on with requests even for previous commissioners who have been serving in this county. We need accountability, we need deliberate, clear allocation where our resources are needed. We are not getting that right now, the San Juan Basin Health. And apparently, the concern is they are not even keeping accurate records at all of these expenses and distinguishing them from LaPata County. So to do it right, it involves local management. We are aware that state statutes require that every 5 years, a health plan for the county or the district that you're in be established and be presented to the state for approval. We can provide our own 5-year health plan. We can do that and identify very clearly how those resources are going to be divided up. But right now, we don't have that information. Do residents of Archuleta County even have any input in the direction and input of programs that are offered? Very little. And so when we have our own health board, all of those things can be changed. How can they, when we are in such a limited minority on the board, how can the residents of our community provide that information? This is the way it will always be when we as Archuleta County serve are acting in a limited way with representation on this board. A local board and department would have 100% involvement of people within our community. And that's why change must come. The 5th bullet point, act independently or with other counties, challenge unlawful mandates and rules. Now, I know that sounds very controversial. And all of us have been frustrated probably at times with mandates that come out of nationally or statewide or locally through our health district. But we are all obligated as Americans to challenge whatever is unlawful or whatever is in violation of constitutional rights that are God-given rights when we see that happening. Our own department and health board can act independently. They can act in concert, let's say, with other counties that have similar concerns to us when things like this happen. Just as nationally, the Justice Department might challenge a law that is passed by Congress if they feel it's unconstitutional. Just as states do in banding together in challenging federal laws. that they feel are unconstitutional. We have an obligation as individual citizens, as commissioners, as people in this county to do the same thing when we observe and perceive that rights are being violated that are God-given and that should not be taken away under any circumstances. It's the duty of commissioners, it's the duty of a health department, it's the duty that we see that should be observed whenever unconstitutional laws have come into existence. Individual citizens, elected officials, and government bodies all have this right. In our system of government, whether it be at the federal level, the state level, or the local level, we have that obligation through free speech, through alternate legislation to change legislation that has been passed previously that is not lawful, through citizen initiatives both at the local and also at the state level, and or through the courts. If we feel as individuals or commissioners or as joint measures by counties, we feel somehow those rights are violated. We have an obligation to manage things in such a way, even in healthcare in our county, that those rights are always preserved for our residents in this county. We do not see this at work in our health department in San Juan Basin. In fact, what we see is just the opposite. As was mentioned by the previous speakers, when criticism is offered, it is stifled, it is rejected, it is treated, and they've said it many times, as misinformation, in spite of the fact that that information that's being presented to them is based on other clear science by medical professionals and researchers that are well trained in their fields, but they refuse to accept it and seem more willing to accept not true science, but political science. And we've seen how so many things, especially during this pandemic, have been politicized. For the future, where will we be if we see statutes that we are not comfortable with now and leave them unchallenged in our state? And we see other statutes that are passed, perhaps on gender equality, perhaps on issues related to health care and mental health care related to the youngest in our public school systems, in primary education, from kindergarten up through third grade. And statutes come into existence that say that we need to have gender education and transgender integration to these young children. Are we going to just sit by and say, no, just because it's a statute, we can't challenge it in any way? A health board has a responsibility to look at and see how things like that can affect the children in its community and have an adverse effect, and challenge it legally when it's necessary. We're seeing issues come up with infanticide, with late-term abortions, gender and transgender issues. We're sharing of female bathroom facilities and problems that have come up with that in various states throughout our country. San Juan Basin Public Health seems to have an attitude that whatever is presented in statute, that without any challenge or questioning whatsoever, has to be followed and accepted. We have an obligation, when we feel something is as lawful as an overreach of our rights, to take that and challenge it by whatever means are available to us. When we have our own health department, we would be much more able to do that. Last point I would like to make: locally address the political and social theories that may adversely influence our healthcare and educational systems. Now, why should we not address this as a local health department? We see in San Juan Basin Health nothing that is ever mentioned on their website, which is a beautiful website. It has a ton of information in it. It was put together very, very well. But there is nothing in there on preservation of freedoms. There is nothing in there that you can find as far as patriotism, love of country, expressions of how we live in a nation where we have been able to develop one of the best healthcare systems in the world. There is no appreciation for that. There is nothing in there about protecting the lives of the unborn and recognizing needs that need to be addressed to their health. What we do see when you go into their system is much on American historical injustices, drawn from critical race theory, but little on American equality, but much on equity. A few months ago, I presented to you, and I don't know if you remember it or not, but it was 2 or 3 months ago, I believe, where I cited in public comments to the commissioners a section of the news feed that appears on San Juan Basin Health to the communications director of the department. It was a news feed, if I remember correctly, I'm pretty sure this is right, July 17, 2020. And whether it was directly from the communications director or someone in assistance with that individual, I do not know for sure. But it was there and posted and is still there and posted on the website. But basically, if you go and look at it, you will see that it was stressing the fact that now that the pandemic had lessened at that time in the summer, that it was a time to address some other issues through the health district. And it was promoting the idea that very clearly that America is foundationally and institutionally racist. Systemically so. Which means our system of governing has to be replaced with something else. That the founding governments of our nation, or perhaps I guess we'd have to say of the state of Colorado, its constitution, are systemically racist and problematic. And that health issues, therefore, in the district should follow that thinking and be applied accordingly. This is not only dangerous, this is contrary to American principles of freedom, life, liberty, and pursuit of happiness that we hold so dear. Jolin's recent presentation to the commissioners, I believe a week ago today, was especially troubling on some of its points. I didn't know that she was going to be speaking to the commissioners at the time. I hadn't seen it, I don't recall seeing it on the agenda that was made public. However, I heard that she was speaking to the commissioners, and so I quickly got online and through Zoom was able to catch the last of the presentation. And later on, I went through the slide presentation that was made available. I don't know what you detected there from that presentation from the Director John, but it was rife with woke socialistic ideology of today, which is based in critical race theory. There were sections of that slide presentation that were very, very troubling in terms of very threatening comments and prosecutorial in nature to those who would dare challenge anything that was presented, any local health department views and positions, because it made them feel uncomfortable. It made them feel they were being threatened. And so explorations were being made on how to prosecute people who expressed these views to a local health department. It showed a very great unwillingness to listen and explore other professional viewpoints and scientific data, as the other presenters have pointed out. This type of thing has been damaging to careers and to businesses within our local county. And we can see that and how it's happened throughout the 2 years of the pandemic. We can do much better when we have our own local health department, and we can prevent those type of abuses from happening. and let ideas and scientific evidence be expressed that is not always being allowed by the State Department of Health or our national government's CDC guidelines. We can do much better with our own local health department.
Thank you. I don't think you'll have find any argument. Well, I'm not gonna speak for Commissioner Brown.
We have 2 more slides.
Oh, you do? Okay.
Yeah, it's just a couple more.
All right.
Yeah.
So we had a lull.
Okay, we're gonna talk about demographics a little bit. I'm sure you're aware that Archuleta County and La Plata County are different. I mean, our population is 25% of theirs. A real key thing is that our population is so much older. Our average is 51, so we have an aging population situation going on that Archuleta isn't having to deal with. Our income is like average income $16,000 less. That's a lot of money. Some people can live off of that, so that's significant. The hospital situation, our hospital has 11 beds when we're fully staffed. Theirs has 82. Ours is a level 4. It's kind of reversed on that chart there. There's not as much service provided here as there is in Durango. And so that's like really key in how we handle healthcare. And then I threw in the septic permits. In 2020, we only had 182. That is a manageable number. We can do this. This is not a big thing. So the way all this demographics relates to public health is our folks are spread out geographically a little bit more than La Plata County. Our older population is going to needs more healthcare and more home healthcare than a younger population. We have limited medical services. We have a great hospital. We should all be really happy about it. It keeps expanding their services and improving itself, but it is still really small and limited in its services, and it can get overwhelmed really fast because 11 beds isn't very many when there's a sickness going around. That just means illness prevention and treatment in the home setting is even more important here than it is in the city. We need to protect that hospital by treating people at home and doing preventative. And I think our own health department, we could focus on that and team up with the hospital and keep people out whenever possible. So customization, I guess, is what we could do if we did it ourselves. So that's enough about demographics. Let's see. What's next? Next screen, please. The next step. The next step, I think, is to form a phase 2 investigative task force. I'm using the word task force because their assignments would be a little bit different. To complete the research and a cost analysis for a local health department. I think we need to move on. I was the secretary, as you know, of the investigation committee, and in the time allowed, we didn't really finish the project, is the way I feel about it. We spent way too much time waiting for San Juan Basin to provide information that they couldn't, and then we just ran out of time. We didn't finish. But what we did learn is that there are numerous counties in Colorado that have their own health departments. Some have been doing it for decades. It can be done. And there are other counties right now that are doing the same thing because they're complaining about the same stuff we're talking about here. It makes sense to many of us, including some people that were on the investigation committee with me, to call forth a second phase of assistance from these educated, invested people in this community to pick up where the investigation committee left off and finish the project. And as Commissioner Brown, you said a couple weeks ago, I think the task force objectives could be more fine-tuned, more defined and specific with a reasonable timeline. I think we could do that. So in preparation for that, we kind of came up with some assignments of what this task force would do. It's a draft, but there's a lot of time in this. That task force would identify all the resources available to address all of these objectives. They would contact and assemble all offerings from various government and private agencies. There are a lot of government and private agencies that help people start their own health department. The resources are out there. We just didn't get that far. We need to research the option to join a health partnership such as the West Colorado Public Health. I think you're aware of that, Ronnie. They can do that 5-year assessment, which is called the Public Health Improvement Plan, which ties up my tongue, so I'm gonna call it a 5-year assessment. They will take care of that for you and the bureaucratic paperwork in Denver. And that way what we do is run a health department, not do all the paperwork. And so we just need to dig into that deeper. There are other ways to get that 5-year assessment due, and it's due in 2023. So we'll talk a little bit about timing, because I have an idea of how we could move this along in conjunction with that. Last fall, when I was looking around, there was grant money available to start a public health department. So we need to go look and see, is that still there? Is it still, I thought it was $53,000. I mean, that would just help us get going. We could contact other counties in Colorado that have started their public health departments, like Adams, Arapahoe, and Douglas counties are just doing it right now. We wouldn't have to reinvent the wheel. Let's go ask them, how did you do that? Why did you do that? We tried this once before, I think, Ronnie, right? And there was a vote and the people did not want to change and do their own health department, is that?
I don't think there was ever a vote.
Oh, okay, because I did think some other counties did that, but we need to look into how this process would work. We need to look at what the structure of the board would be like, whether it would have medical people on it, whether it would be board of county commissioners with a doctor and some medical people, somebody from the community. There are options of how that board would look, so that would be something they would investigate. And look at budgets of the other 3B counties more closely than we did in that investigation committee. We got their budgets, but we didn't really take time and dive into it. That needs to be looked at because all the numbers are there. It's just not rocket science. Might the septic and food safety and air quality inspections be done by a different department within the county, or could we sub it out to the private sector? Could we deal with some of these other health department issues in other ways besides doing it ourselves? So then we would need to look at what can be subbed out, because we know San Juan Basin, a lot of their services, in fact, most of their services are done by other entities here, by the Pagosa Medical Group and Axis, and they're not here doing anything. It's obvious they're not. Why can't we sub it out the same way they are? So we would just need to find out what can be contracted out and find the providers who are already doing it anyway, and then figure out how many people do we need, how big a closet do we need, how big an office do we need, and put together the plan. I think sometimes we try to make things harder than they really need to be. So the last thing they would do is create a timeline of what steps would happen to make this happen. My thought is they would be done by August 31, reporting back to you by August 31, so that you could give notice to San Juan Basin on December 22, so December of this year, because our 5-year assessment is due by the end of the year in 2023, and we would have that assessment done by the entity to which we are moving. So that would be the partnership that we might join to get that done, or whatever other options we find for getting that done. But it would be done by us, not San Juan Basin. So that would be a good break-off point. So this is a draft. I think it needs to be refined and objectives clarified even more. But there are educated and experienced members of this community just waiting right now to help finish this. They want to do it. So it's starting a small business. It's just, I think we can do this. We can do this. We can do this.
We have the last slide. Yeah.
I think we're wrapping it up.
And I want to thank you guys very much for hearing us today. I think this is hopefully the first of many conversations we have. Where I came from, I don't think I would have had this opportunity to sit down with you guys in the way that we have, and I don't take the opportunity for granted, so I appreciate it. And, yeah, with that in mind, I hope this is one of many conversations, and I think that we can all agree that you guys care, you show up to work every day to work for us, and we care, we keep showing up here, and we all care, so let's do what's the best for our community.
And we hope we can see that final task force, smaller committee complete that work so that a decision can be made.
Any questions for us or anything we can follow up with?
There's a lot of information,
It is,
honestly,
yeah.
and I'm gonna have to put some thought from my perspective into this a bit. I'm trying to, I guess, reduce this down to a manageable, topic that I can contemplate and decide how and why and where and when.
I totally understand that, and when I initially came up with the idea of doing an investigation committee, I think I talked with you about that in January of 2021, I guess, not that long ago. I knew it's too big a project for you guys to do on top of all this other stuff. I mean, even what you heard today would take me a week to figure out. So what we're doing is offering the help of some smart people to do the investigation, to continue. We just didn't get done. So hopefully take that off your plate a little bit. And so it doesn't come to anything. So we find out that no, what we're doing is fine. Okay, but we weren't done. I don't think we can make a decision until we keep going.
And there are communication and transparency issues that need to be cleared up. There are issues that need to be addressed. And if anything comes out of this today, hopefully it's that.
And Commissioner Brown, to just follow up on Mary Beth's comments to what you say, you have a lot here to consider and to look at. I remember watching, it was one of your work sessions, maybe about a month ago or so, and it was when you were discussing this very issue as whether or not to make a decision on going with our own local health board or not. And I was watching on Zoom, and I noticed each one of you, when the subject came up as having a knowledge of healthcare, you each kind of laughed and said, well, we don't really know anything about that. And I thought, well, that's something I can certainly relate to as well. But then I thought, that's why we have people like this. And we have people like this in our community that we can turn to, who have the knowledge and expertise in the medical area, not just on the management side, which I think you could all handle easily, but on the specifics of healthcare itself and various parts of it. But that's the type of thing you turn over to them to make decisions on and to guide you in the process. And we've got a lot of talented people in this county. I'm sitting right next to 3 of them right now. And I know many others in our community. So don't get bogged down by all of the information. Use the professionals that we have in our community to help make that decision. And I think that's the way it's easiest to handle.
I don't think we need to spend money on consultants and stuff like that. I really don't. And I've talked to some people that have run medical centers who live here. These are all people that are here waiting to help. We don't need that. We're free. And then you can decide what to do at the end. You know what I mean?
Yeah,
Because we want it.
I totally get it. And, you know, the thing is if this moves forward, we end up making a decision, we gotta have all the information in order to make a reasonable, sound decision at the end of the day. Fire related, any emergency scene or any type of situation that you're in, if you don't have all the information you need, you're not gonna put the fire out. You gotta have it.
So essentially what we're asking for is your approval to create the task force, create objectives, timelines along with it, get back to you soon with all that for your input to make sure that we're getting the 360-degree look at this situation that you need and that our community needs to make this decision. And that's really, we just want the approval to continue and work closely with you throughout this process to make sure we're supplying the necessary information.
And I don't even want you to have to do what the task force would do. I would like to provide that and you edit. Make that easy.
Yeah, yeah.
You don't want to invent this. I already did, and this is only one page that reduced the thing. Commissioner Shaw, you're gonna be at the Thursday meeting at the San Juan work session.
Well, I'll be by Zoom.
I mean, of course, yeah, you can't attend those. so-
Well, I think we're supposed to be public, or we're supposed to be there this time, but I've got some stuff keeping me out of town, so I
Is the public welcome this time?
can't. I don't know about that.
I sent them an email asking that and never heard back. That's just like how they are. But Shailene and I came up with some, like a synopsis of what we think about San Juan Basin. If you're in that meeting and they ask you like, what are the reasons that you would want to leave, or we've got just a couple outlines here that you could use if you like to respond back to them.
We've heard them ask you a few times.
I mean,
And we know that not all of our opinions and beliefs reflect yours,
Right.
but as our
but you can
representative,
say,
you
this is
could
what some of my
say,
folks are thinking.
this has been
And
some of
so
our
we're gonna
concerns.
do that to you and pick out it what you want, but it's hard to get input to them if you're in the public. They
Right, and
just
I
start
brought
friendly
that
about
up too, you know, the fact that the public would like a better communication with them, and you don't have public emails.
Yeah.
You know, and to the board as well, and it wouldn't be necessary for the board members, if they thought it was too controversial or whatever, they could have signed that to the staff members, because they could reply to you guys, if it was all the public. But so far, I haven't got any traction either.
Yeah, you're in a hard spot.
Commissioner Schaff, I'm wondering what your thoughts are, if you want to share them, on one of the comments that was made at the last meeting of San Juan Basin Health, where the La Plata County Commissioner made the comment of they need to address this issue and get it resolved because they're concerned that Archuleta County might be drawing down or pulling them down. And I'm not sure who the them was that commissioner was referring to, whether it was the health department district itself or if it was La Plata County. But I heard that comment was kind of concerned about that. Why do they feel Archuleta County is potentially going to pull them down? What were your thoughts on that comment?
Well, the way I would interpret it is, you know, they're worried about the financial structure, stability of, you know, if we decide at some point just where we're gonna go. I think, well, almost without doubt, they'd have to restructure, and La Plata County would have their
Oh,
own.
they would.
Their own
Yeah, I
health
was gonna
department.
ask that.
And then we would have
They
ours,
can't be a
if we choose to
district.
do that.
Yeah.
By
But,
themselves.
I mean, I think Mary Beth brought up, there's also a great opportunity, if we do go that route, that we can contract somebody's services out, or we can just take on what we want and contract the others out. And that's the big deal. I think the big unknown is the money. Because I think anytime you have local control, when you have three elected officials sitting here representing the citizens of this county, and we actually have control of it, then we can more easily represent what the community wants, what our constituents are asking for. So I agree with that. I think it's, you know.
We need to finish the budget and the money part, because that's the number one thing everybody's gonna talk about, right?
Well, it is. It always comes down to money.
Exactly.
How are we gonna
But
vote?
But I
it
think
is.
there's funding out there.
You wanna know the
And I have-
problem, follow the money.
Yeah.
There's a lot of state and federal funding that they receive as well, and
There is.
the knowledge of where that comes from is crucial to make
It
this
is.
decision.
So you might get a part-time grant writer from somewhere. They're all over. As long as they have internet, they're out there.
Just takes money.
Question.
Yeah.
If San Juan Basin Public Health was to dissolve, what happens to their assets?
It's a good question, I don't know.
Could you look into that? for me?
Yeah, I really don't know how that would work, and I might have to check with other county attorneys to see what has happened when
Like the tri-state one with.
when tri-state
Arapahoe and-
dissolved, right.
What happened to their
Douglas.
desks and the building
Right.
and stuff?
And I don't know, I'm not sure how that would be divvied up, you would think that since the money for a lot of that infrastructure and the personal property came from Grant counties, that we'd be obligated to provide some of that to us, Archuleta County, but I don't know for sure, because it's a relatively rare situation that it happens.
Yeah.
I mean, things
We'll
before.
have to see how that
Right,
works.
and I just don't know, because it came out of a joint budget, yeah, I don't know,
Yeah.
and that's something we
There
might
might
have.
be an asset too we can have
And
also to get us.
Very likely would be part of negotiations for our departure from San Juan Basin Public Health, and if that would happen, La Plata County would also have to figure out what they're gonna do, because then they would basically, La Plata County Department of Health, because that's all they're gonna be serving. And so the board would have to be formed as well.
And they probably aren't in the mood for that.
I have no idea. I
Maybe
mean,
in their best interest too.
I mean, because right now, San Juan Basin Public Health has 91 employees, and how many employees does Archuleta County have?
2.5.
No, I mean total, how many employees do we
The
have?
whole county?
We have 180.
180.
Yeah, so I mean,
I mean,
Wow.
they're half our size.
they're half our size. So that tells you, I agree that that 80% is a little disturbing.
Yes.
So, but anyway, yeah, it's something we'd have to look into during the year of, when we give, if we give notice of a year to transition. And that would be something we'd have to work out during that time frame. So.
So would it be possible for us to, have a much quicker presentation to go over our objectives? Let you all our goals, objectives, timelines, let you all absorb it and get back with us. Can we get something scheduled for that? Because that's really important for us to be able to hit the ground running with the project.
Before we make any decision on that, I think it has to be at a regular.
Yes, it would have to be at a regular
So-
meeting, so if you would like to present something for the board to consider an official decision, you need to put that together, provide it to Mary Olinsky, and.
So it would be
So
like
give
a
it-
timeline and then a task force objective? Is that
Right.
what
Something like that would
That would
be-
be the first step.
I would say a task force with the timeline after, because, you know, if you do the timeline first, and not having a task force, then.
Well, that'd be, I mean, that's really what I think the board would like to see is, here's what our objectives, our goals, our objectives. Here's a timeline that we would like to achieve those objectives within. And then, because the board would have to appoint the committee to move forward, to actually provide information to the board.
Because I mean, you
Well-
kind of imagine the order of things that would make most sense. Let's go do this first before we do the money part, you know what I mean?
And as you've had time to think about that over the past weeks, when you yourselves first brought it up, some of the comments you made, we wanted to be a much smaller group of people, a smaller committee. I thought all of that was appropriate. Do you have any thoughts on that in more detail right now, what you would like it to consist of?
I have my opinion. I mean, I would say 5 or less, odd number.
I would agree with that.
And we'd like to make recommendations for you. Obviously, you may have some other really talented people in mind, but we would like to put forth a list with qualifications too.
It'd be great to have a group like this with different backgrounds.
So, and let you all decide who you think would be best suited.
We had fallout in the last investigation committee. We started out with 7, but there were really 4 that did the work.
Right, they're
You know, so
always-
it needs a group to be too small, or it needs to be so specific that we know they're not gonna fall out. Like, you are here and we are gonna work hard and get this done, and not have people that don't have time to come to the meetings and,
Yeah, the
You know,
commitment,
I
the commitment
understand.
has to be there,
yeah,
number one.
yeah.
Commissioner Miller.
Before we go any further, so I didn't want to interrupt you during your presentation, but, you know, we do have, community members that reach out to us from time to time. And one of the community members that reached out to me recently, was Dr. John Bruce. Dr. Bruce is right behind you. And, you know, in full disclosure, Dr. Bruce does sit on the board of San Juan Basin Health, but he is not here as a San Juan Basin Health board member. He's here as a citizen that has offered to be a resource, that's offered to, you
Awesome.
know, help us kind of, or help me kind of identify and potentially clarify some of these things that are being said. And I wonder, Dr. Bruce, if you have any thoughts. It's my understanding that you have been a part of creating a health department before. And if you don't have thoughts that you are prepared to share with us today, or just on what the comments are here, I certainly respect that, but maybe at a later time, we might be able to ask you to share those thoughts with us.
Sure.
Please go on. I know you had a phone call that took you away, so
Yeah, sorry, that was
That's
an
okay.
urgent call.
that's perfectly fine.
So, I want to make sure that it's really clear. I don't represent San Juan Basin Public Health Board here. I'm a citizen of Archuleta County. I'm very interested, I'm vested in Archuleta County. And I think that, I do have some experience. I'm an infectious disease physician. I have public health training. I ran a public health department with over 150 employees and millions of dollars in grant funding. So I didn't actually start the health department, but
Thank you for that clarification.
yeah, I do have some experience in public health. Public health is a passion of mine. I think it's something that has typically been underfunded and under-resourced in not just this country, but countries around the world. And so, I do think it's an important part. Hearing some of the comments and presentation that was done today, I think that's wonderful that, we have people who are passionate about this issue and doing something for Archuleta County. And, wanting to try to explore what the best options are for us. A few comments that I would probably offer is, because I did hear something in the presentation, there's sometimes a mixing of what is our healthcare system from what is public health. And I think that we need to be careful that when we think about planning for public health needs, that there is some lines of distinction between the two. And I don't think that's always clear for people. We do have considerable advancement in our healthcare, our acute healthcare services here in Archuleta County over the last decade or so. I remember 15 years ago having to put pressure on a laceration and drive all the way to Mercy to get sutures because there was no urgent care here, there was no hospital here, there was actually maybe I think only one primary care physician here, so.
You would stitch you up if you could.
You could find them. It wasn't readily available, so we made some pretty good progress in acute health care. But we need to differentiate that from public health and the needs of public health. And I think public health really has to really focus on providing services and prevention of healthcare issues that are facing our citizens of our county. So we really have to understand what are the determinants of health in our community. And if you look at, what are the causes of death here, what are the things that are impacting our health. Those are some of the challenges I know that the commissioners have faced in trying to get some basic understanding from San Juan Basin Public Health about, how are their services meeting the needs and addressing the issues or the determinants of health here in Archuleta County. And it's different from La Plata County. There are some similarities, but we clearly have a different county. So I think we have to think about that. The other thing is, I don't think that building a health department is only about money and providing an office space and hiring a bunch of people to man that. I think it's much more complex than that. When you talk about public health, I think you have to talk about having people who have the expertise and who have the training and who have the experience to be able to manage and deliver those services to the citizens of your community. So it's not a trivial matter to hire somebody with the training and expertise that's needed to provide that service here. And, we have a county, you can see our median income there. yet real estate is very high. I mean, our real estate is almost as high as La Plata County. So that means we have to hire people with training and expertise at salaries that are going to be competitive to bring them into our county. Because we may not have the necessary public health trained people within our county right now. So how do you bring those people in on a salary that they can actually survive here and you know, get affordable housing? I mean, these are not trivial matters. So I think we have to think about that very, very carefully, because you need, if you're going to build a health department, you really need to have trained and expertise people to be able to do that. Whether it's restaurant inspections or you know, providing you know, women and infant child services or immunizations for children or whatever it is, you know, diabetes education, you know, those require people to have some knowledge in public health. So I urge you to at least consider that, and it's not just a budget number, and it's not just an office space. The other thing is that you know, building a health department it may take time, and so it's not something that can happen overnight. And so, you know, maybe considerations in terms of a gradual approach to this, and you know, that might be something that the commissioner should think about. You know, how do we? Are there some services that you could do initially and then gradually build? And then the other is to really weigh all of these things with, you know, trying to see, you know, how does that plan kind of offset, you know, a plan to try to improve transparency and communication with the existing structure that we have? Because there's trade-offs, you know, there's benefits, and you know, these things are there's pros and cons to each approach, and I think you have to kind of weigh those very carefully. The other thing about public health, I think we have to really be careful of, is not allowing, you know, we have a diversity of citizens within our community, and we have a lot of difference in terms of political viewpoints, a variety of health viewpoints, a variety of concerns in terms of priorities, and we have to figure out how do we serve our community the best way that benefits all of the citizens of our community, and not just one viewpoint, not just one group of people, because we do have diversity here, and I think we have to take into consideration all of the citizens. And if we're going to truly serve our communities, we have to serve all of the people, not just a few people. So we have to be very careful that our own individual viewpoints don't cloud our judgment in trying to address the needs of all of the community and our citizens. I think we have a responsibility as servants and citizens of our community to try to benefit everybody. And those are just some thoughts I have in listening, and I really appreciate, you know, you all coming here and voicing your views in the presentation. I'm sure it will serve the commissioners very well. So I'm here as a concerned and interested citizen in Archuleta County.
Well, we appreciate you joining the board there. We were really happy when that happened, because, you know, there's a representative from Archuleta County there.
Well,
Yay.
some of his knowledge too, that was huge.
Exactly. Yeah, that's awesome.
But to build on what Dr. Bruce said, you guys brought it up, and I don't know how we go about this, so with the staff for that, but I think it's important that we do some kind of a public survey.
I fully agree.
To see what, you know, what the public as a whole, what they want us to do, what they want to see happen.
Yeah, I have no idea who didn't get served. Who had needs that didn't get
Well,
served?
exactly, we don't.
Or
Unless we
is
find-
everybody happy? And was it 12 people or 120 or 12,000? Or how many people went there? I don't know. There's no answers to that. That would be great to know.
Well, yeah, I think that's probably the most important cog in this whole wheel, if we start there and then decide to move forward from there, I think that's probably the best.
What do you think, Dr. Bruce? Is that useful? survey the public and see where they stand on?
I think it's fine to survey the public. I think that surveys like that often don't take into account the complexity of the situation. And so you'll get, a simple survey, yes, oh, we should stay with San Juan Basin Public Health, or no, we should split off. But, the public, the average person who's, working their ranch or going to the restaurant or, serving in a business here won't understand the complexities of public health or creating a public health department or improving relationships with San Juan Basin Public Health. So they may have a particular view, but I'm not sure that, the survey will do the commissioners a whole lot of good, because it won't be able to really get at the complexities of the issue.
And I think many times it's how the survey questions are.
Well, I think
I was gonna
that's the
say, I
point.
would put that on there.
And the other thing is, I think that if there was a survey done, and I can understand the request for it, I think it would be best to serve the public after the task force has completed their work. Then we would have a clear comparative to present to the public over against what we have with the health district, and then over against what the task force is describing.
And to give you a good example of that, if you look at England, for instance, with Brexit, they put it forward as a referendum, yes, vote for Brexit or no vote against Brexit. But the common public didn't understand the complexities of the whole economic systems to be able to really understand that well. And so, it came down to a referendum, and yes, they voted, and they moved, and now they're having to deal with the complexities that are impacting them. And, some of them said, great, this is wonderful, but, we didn't understand, what's now hitting us. And others, so whenever there's a complex situation, it's hard to get an up or down, yes, no vote.
And like electing a president.
So do you think, Archuleta County could, just as an example, I'm just throwing this out there, could take on septic inspections and still have them do the rest of public health? You were
I
talking
think
about
there's
maybe
a
slowly.
possibility. I think we're capable of it, just depends on what the law allows for. I think we
I
can
mean,
pick and choose the ones we want as our health department instead of everything else. I think
Well,
that's
there's
certainly think you can.
minimum things that the Department of Health has to do.
Right.
Whether or not be internally or by contract externally.
But I mean,
So-
can we take back things a little at a time as we develop our,
I mean, right, and that would be part of the transition, it would be possible, if the county decides to withdraw, to, again, contract with whatever is left at San Juan Basin Public Health or other entities, to provide services until such time as we can bring people in-house before, or maybe it is at a level where it doesn't make sense to have someone in-house doing it, but continue to contract it out. So long as the services are in place, and we meet the statutory minimum requirements, I think we can choose the system that works best for us and take a look at, other counties of similar size. Because I like the Mountain County was at one point in time part of San Juan Basin Public Health. And then they withdrew and formed their own department of health. Of course, they're a little bigger than we are. I can't remember more along the side of their plot. But again, we can look at other counties. I'm not sure, like Delta or, I'm not sure Route is the same size.
and we need to dig into those further than
Right,
that
to see
investigation committee did.
what they do in-house, what they externalize, and just kind of get a really good idea funding wise. And again, part of the survey maybe is our Archuleta County citizens willing to vote in a tax increase to fund the Department of Health? Because that may have to happen. And there's been a lot of reluctance to fund things in this county in the past, which has now kind of tied the county's hands when it comes forward to funding other services and other departments. So that may be something that needs to be addressed as well. You may want to also explore the statutory limitations or statutory requirements of being all in or all out, or can you be partly in and partly out?
I don't know what the statutory requirements are in the state.
Well, I think some of that could be spelled out in the 5-year plan. That you take care of essential services and that you have a plan in place how to address other services gradually moving forward. I would think a state agency that reviews that 5-year plan would understand that and would be sensitive to it. At least I hope they would.
Thank you.
Appreciate you guys' time.
Great time.
Grants are probably.
Yeah.
Thank you.